Hi, and welcome to Mind Your Mouth podcast. Today, we are bringing you two amazing doctors. I am so excited to get them into the studio so we can tell you more about what Dr. Liz Turner and Dr. Meggie Graham have been up to. You are watching Mind Your Mouth podcast, and I am your host, Melissa Mugno. So let's get into it. Well, hello, ladies, and welcome. I am so excited to have you both here today.
We're so excited to be here. Any opportunity to hang out with you is awesome. But of course, now we get to talk about our favorite topic.
Yes. So many different things for some of you guys. The whole reason we started this podcast was because I've had such an amazing opportunity to have great conversations with so many amazing doctors and work with them on their passion projects. But I wanted a lot of other people to hear and see different sides of some of their favorite doctors. So the one thing that I promise all the listeners that tune in here is that they may have seen you guys on different podcasts or even on your own, but I want them to maybe get a little bit different side of you guys here. So I always try to drop into a little bit of the spiritual, the human growth side of things. And I feel super blessed because I know you both, not only on a professional level, but personally have done so much just work with yourselves, your family, the beautiful things that you're doing and your Untethered project. And I first just want to start off by saying that I couldn't be, and I say this like so sincerely from my heart, the two of you together is like peanut butter and jelly. Like it is, I don't get, there's not a lot of opportunity that I've gotten to see both people in their own spaces and then together and separately. And like there aren't two people that I know that make up each other's like different sides of their brain, like the two of you. And I don't know if either of you know this, but I had notes and one of the bottom, and I go, they really are better if they work together.
I love that. That's weird.
Yeah. And I think one of the times with one of you, like it's the truth, like there was just this beautiful match. And I mean, we'll get into it a little bit, but I just like to see what you guys have done with your branding and then the kit togetherness. So why don't we start is let's tell us a little bit about who you both are. So Dr. Liz, if you want to start a little bit about your Airway and then like how you met Meggie and then Meggie, your little bit of journey and then tell us about the birth of Untethered. Well, we know how Meggie, you started to it and then how it came together. Tell everybody all about that. Dr. Liz, do you want to start?
Yeah, so I was a general dentist for 8 years before I started discovering the link between oral restrictions, airway health, what it does to our whole system. And I had thought I'd been in the wrong field because I was like, I don't know about this tooth mechanic thing. Like I was wildly unhappy with what our profession was offering. Because as somebody who always valued general health and wellness, I just felt like we were missing something. And it finally clicked after I had my son. So started going down the rabbit hole, eventually bought my own dental practice, started Bloom Center for Sleep and Airway Health within that practice. And Meggie and I, our paths kind of kept colliding, but never really intersected. So we would like kind of go by people. Like I remember seeing you at a Zoggy course. And I remember being like, I like her outfit, but I had no idea it was actually you. And you were talking to our friend Courtney. And so it's like we kept passing each other, but never connected until a friend kept trying to introduce us through like Instagram. She's like, you got to meet my friend who's a dentist. And we're like, yeah, we got friends that are dentists. And so finally we end up connecting. And like you said, better together. I mean, I'm a different version of myself when I have Meggie in my life. And there are definitely times where we lift each other up in different points. Like there are times where Meggie's doing stuff that I'm not capable of doing and vice versa. And so that's where kind of Dr. Graham, you can step in on your story.
So very similar paths, right? Like, so we're over here, each of us living very parallel existence, peanut butter and jelly, like, but totally different, right? We're very different people, but we each had our own general restorative practice. We were both committed to CE. My CE passion was mostly out of trying to find joy because I was like, what the hell am I doing? This isn't fun. And then when I started going down the CE rabbit hole, I was like, oh, wow, there's a whole other side to dentistry, a whole other level of excellence that I want to achieve. But then there was pieces that just didn't align, didn't make sense. So no matter what I brought back with my knowledge, there were still patients that continually broke things, continually needed to come in for more dental work, despite how frequently they came in for their hygiene visits or how well they took care of their teeth at home. And when I was in school, I was taught home care and diet, the end. Like that's it. That's dental risk. And so then I was exposed to Jeff Rouse and he planted the Airway seed. And I was like, oh, like, aha, like this light bulb went off. And so I went down that rabbit hole. And like Liz, in my general dental practice, Untethered was born just because I needed a place to start to see these patients, because you really can't have these conversations in a hygiene check. You can, but I assure you, you will lose patients and you will lose team members because it is annoying and does not fit in the flow of a dental office. Ask me how I know that. So,
Still fighting that battle
oh
years
man,
later. You're like, wait, why can't you do it? I'm like, because there's no time.
there's no time. Come back and see me. So then when finally our friend, again, we were both like separately but equally telling our good friend, our mutual friend, that now we don't really need to meet another dentist. We have plenty of friends. She finally was like, you guys need to meet. You're saying the same things on social media. You're talking differently than any other dentist I've ever heard. I mean, this is a long time ago. And so we finally connected. And
I think our first meeting was at your house because I was like, hey, I'm coming to Milwaukee. And you were like, you should sleep over. And I was like, sounds cool.
Was this the story where you got there and it was like late? It was like something. I remember you guys telling me a story. It was like, Liz, you either got to Maggie's house and it was like late. You had to go outside. There was, I just remember.
There was
like
one time, it wasn't this first meeting. The first meeting was at my house. We had a sleepover. We became instant friends.
Her husband was like, this is weird.
There is a time that she flew into Milwaukee in the middle of the night and she was coming to my house and we all went to sleep and forgot she was coming and locked her out. And for some reason, I hadn't locked my car, which is in the driveway. And she got into my car and crawled underneath the yoga mat and went to sleep in Wisconsin fall. It was probably 50 degrees. And I was like, oh my God, this is ridiculous. So
that shows
the reason I knew your car wasn't locked is because it's typically not locked.
No, I don't know. I never know where my keys are. I don't know where anything is. And that's where she comes in to help me on that. But when we started connecting after we met and became in love, we started doing things together and it was so much more joyful. Now we're sharing things. And we were both at the time trying to forge this path in creating an airway focused practice without a huge resource, right?
A lot of times, there's this conversation that a lot of dentists don't want to always have with each other. And like when you're in that room is like, to ultimately say, I'm struggling. Like, I love this. I want to do this, but like, I'm not making money at it, or it's draining my books or my staff. Like I have this great staff. They want no part of this, or, you know what I mean? Like not everybody drinks the Kool-Aid or goes all in and just absolutely changes their, we've talked about it. Like, for me, Airway was like, it was like a rebirth, right? Like, I mean, once I saw it, I couldn't unsee it. I couldn't talk a different way. I think the two of you share that, right? Like once you saw it, it wasn't like an option to go back even if you wanted to fight it, you couldn't. And that creates a lot of upheaval in a very well orchestrated world that's already existing, right? You got a good practice, it's making money, you got a spouse, you got a couple kids, whatever your life is, it's trucking along. And then you come in with this passion project, which is very much an entrepreneurial project. It's, different than everything. And you absolutely shake up the entire apple cart of what you're doing.
Without a plan, right? We're doing this without a roadmap or a plan. And we kind of decided okay, why are we both doing it separately? Why don't we combine forces? A, we like hanging out together. How fun is that? And then B, we get to split the work in half. We get to come to the table and share what we have learned the hard way and the easy way, start to combine our forces. And all of a sudden we started making progress much faster. And that's kind of when you met us. And then the other part of it was we are evangelistic about this. Once we see it, we can't unsee it. And we believe that this is dentistry. So there shouldn't be a separation between dentistry and airway dentistry. Whether or not you acknowledge it, whether or not you understand it, you are influencing the airway and you are influenced by a patient's breathing. So we want other people to know about it. So we wanted to create a bigger footprint. So what better way than to just double our presence?
So walk us through a little bit, the birth of the combining of bringing these two things together.
Yeah, I remember Meggie, we were sitting next to each other and we were like doing something and I don't think it was anything related. And you look over, you're like, wouldn't it be fun if we just worked together? And I was like, Sounds cool. Let's do it. So I think we still have the papers where it's just like written out. It's just like
Plan.
a pile of 8.5 by 11s where we were just like jotting down notes. And this was goodness years ago. And so as we've evolved and really tried to systematize things, as you know, Melissa, because this is something you do, like there's definitely hurdles because at the end of the day, we need all of our team and our people and ourselves to be on the same track. But I think that's the cool thing about us is like the reason we've hemorrhaged so much money in learning is because we always think there's more to learn and we can learn so much from each other. Like there's not always a right and a wrong way. There could be a better way. And if we don't collaborate like that, we're never going to find it. So I would say like both of our surgical techniques, both of our orthodontic protocols, everything we do is better because we've learned from each other, our successes, our mistakes, and all of the other things that we bring in on the side. So yeah, I mean, that's the fun thing is Untethered is clearly the better name. I mean, Bloom's cute, but like it was time to move on. So we have, I love our website. I love, love, love our website. And one of the things I love about our website, and I'll just plug it, there's a resource section. And if anybody's got any literature that's not on that sucker, please, please send it to us so we can add it. We want people to use this website as a hub to teach other people that there is evidence out there supporting this work that you guys are doing, that we're doing. It's hard. It's a hard battle if you fight it alone.
Let's talk about the brand for a second, because I do, if it's okay, I want to highlight both of, some of my favorite parts of both of you and the things I love that I don't know if everyone else. So Meg, Meg, I mean, if you were a dentist, would you not be an interior designer or like, I mean, because like, I mean, I want to hire you to come like build and decorate a house and do things. I mean, I don't know if people know how, I mean, guys, if you get a chance to go to Milwaukee, go to her office, go to her home, like, you are like, you reek coolness. Like there's just something you have a very edgy design style about that of you. I mean, is that something that a lot of, I don't know if everyone knows that. I mean, I feel that way.
I think it's a really positive spin on it. I'm for sure going to play the soundbite back to my kids. Like I'm an edgy cool, but like I would say my attention and focus, my hyper focus on detail influences my design, and I also have a very eclectic and so without any formal training, I know what I like, and a lot of it ends up being kind of artistic, and it's a conglomeration of new and old and used. And one of my favorite words, this is something that I don't think I've ever said on a podcast before. My favorite word is the word provenance, and it is the history of a thing. And it's the story of a thing. And so I think that as much as I like stories, I like antiques and I like objects that have a story. And so I tend to collect things that I gravitate towards based on their history and story.
Well, and I think some of my favorite, like when I first got into dentistry, and what made me fall in love with ortho was actually the artistic side of it, right? Like this side of like I was really lucky. This one orthodontist, like he was it was art. You know what I mean? He was like really trying to craft. Like you could find his smile a million miles away. I mean, now I would go back and tell you he was doing Airway Dentistry. He might not have admitted that back then, but he really cared about these big, beautiful faces and smiles. And I feel like that artistic is something, right? Like when you're looking at the face, that I think that goes really hand in hand. And for me, when I saw your brand, I think like, the Untethered before you guys merged, I thought that was like so detail oriented and so like, just such a really beautiful replica of your side of things. And just that, how dentistry and artistry all come together.
Thanks. I had a lot of fun with like the design of not only the brand, but the word. I love words too. I love to read. I love words. And the whole idea of untethered is it's obvious at the face value, tether old tissues, right? But also this idea that we're untethering from the traditional medical model, which in my very loud, opinionated opinion is broken, right? We're not focusing on prevention. We're not focusing on the foundation. So often when people are seeking aesthetics, they're not understanding that if you put everything in the right place and you idealize function, the aesthetics follow. Everything that functions well is beautiful. And so I really had a lot of fun with that portion of it as well.
It's so good. And then to flip sides, Dr. Liz, your level of detail and organization and the ability to project manage and understand and can I tell you, staff wise, the kindness that comes out of you, and as a leader, to see your team at the time, when I was at, like, your team was family. Like, these were like, I
The
mean, these are,
best.
and and both of you, the one thing you both that I got to kindly see is just like your families, your spouses are so lovely, and like your children and the way they roam, and just such a huge testament of like both of your characters. But Liz, like, I just till this day, whenever I talk to them, like, your ability, like your team truly was a testament of just who you are as a person and that level of organization. And everybody has their area of genius. And to think if you could take those two areas, that beautiful artistic side of seeing things, and both of you just like having this obsession of the same thing, but bringing this like right and left brain together is to me like, I was like, wow, it really makes Untethered something to really not, shake your head. I mean, it's something to watch out for. And I'm excited to hear a little bit since you guys have brought it together. And Liz, just like, what are you guys doing to like, kind of put some protocols and like in your new trainings and your courses? I'm kind of excited to like hear how that all kind of came together and where you guys are at with some of that.
Yeah, I mean, we have a growth mindset, right? Like, we can't do this alone. I see patients from out of state daily. Like, people are coming from all over to our office, which is still that little tiny space that you've been to. I was supposed to move like a month ago, 6 months ago, but hopefully by the end of the month when my lease is up, we'll have a space that's 3 times the size and has the brand vision and design that we want to bring into it. But for us, it's about growing the opportunity for families to have access to care that's appropriate for them. So
Mhm.
not everything's one size fits all. And if we can't help other providers understand how to recognize, refer, treat these types of issues, we're never going to make progress as a profession as a whole. And so, one of our goals with launching the Untethered Way was to help dentists understand the foundation of airway health. So that's what our course is. This is the foundational side of it. You can take every airway course. And I actually texted somebody this earlier. They were like, which course should I take of this protocol? I said, take all 5 of them because you're going to get something out of each one, because there's no perfect. It's all collaboration and figuring out what works best for that person. So our goal is to really improve upon dentists' ability to look for and recognize beyond just the teeth, understanding how important the foundation is, not just for their dentistry, but for the health of the human. And our hope is that we can have other providers working with us in the future as we continue to grow. We both have a number of providers that work with us who are fabulous in our offices. And so it's not like we're at this alone. There's what? You have 2 other doctors with you. I have 2 other doctors with me. And together we've been able to make more of I would say, a dent in helping people and providing knowledge to other providers, dentists, hospitals, ENTs throughout our communities.
So tell me, so in both practices, you guys, do you still have like what's going on in the Milwaukee in your office in that side of Untethered? And then we'll talk a little bit what's going on in Liz's, and what would you seek if people were, coming out to you or taking the course? Like, what's the big vision? What's the big plan? I've seen you guys both on social media talking a lot about your plan and your vision and your mission statements. Is this a bigger, broader picture of the entire, program and the brand itself and the experience?
I think there's a couple different arms to this, right? One
Mhm.
is I am humbled that people come to Milwaukee, Wisconsin from out of state. They will travel so far after having gone through so many consultations, just following a gut, looking for somebody to listen to them. And it's unbelievable. And we're so grateful and we're so lucky to be able to help them. And it shouldn't be that hard, right? There is such an access to care when it comes to this type of treatment issue that we are motivated to teach other dentists just awareness, because there's a huge, huge serving lift the dentists can do, even if they don't want to do frenectomies, even if they don't want to do ortho, even if they don't want to do early intervention. If you can just be aware and help direct patients, that's a huge service. So awareness is our number one goal. Second, we do want to find other providers that want to collaborate, want to condense time and say, hey, this took us years and tons of mistakes and tons of heartache and sweat equity. here, we've figured it out in a way that works really well. Come join us. And we can hopefully spread the brand into a lot more locations so patients don't have to travel so far to get to the kind of treatment we think that everyone deserves.
Amazing. So if somebody goes on to Untethered now and like that experience of the website, is it like which one's local, which one's closer? Because they're going to kind of get the same vibe, whether they come see you in Milwaukee or they come to Denver and see you, Dr. Liz. Is that kind of the concept? Is that what
So yeah, we being two practices that existed that came together, there's always going to be a little bit of nuanced differences between the two practices. And we have this goal of like the ideal version that we're going to continue to replicate. And I think that between the two practices, what is similar is there's basically three demographics of patients, right? There's the infant patient base, the babes. There's the littles. Those are the little kids that are 2 to 5. And then there's the big kids and the adults. And depending on where you are in your growth journey, in your life journey, and your symptoms, there's a space to jump in. And so we have really set up systems to be able to provide services to any of those demographics. On my team, I have cultivated an awesome team in Milwaukee, and I have people that help with just frenectomies, just with quarterbacking, ortho. And so it is, Dr. Cook has quarterbacking down and she loves to help with the orthodontic component of things. And Dr. Corbin is a frenectomy expert. And so he really does a beautiful job with the artistic surgical skills of the tongue tie releases. So in our practice, that's how it works. And I think it's pretty parallel to how Liz is working too.
Yep. So that's where we have two providers, Dr. Kack and Dr. Kessler, that focus a ton on infants, and they're fabulous. And that's what I tell families, is because oftentimes they're getting referred to me. It's really just that my name is on the sheet of paper that was printed out 5 years ago and is now handed to the patient. It's not that they need to see me. It's because we all are looking at and assessing for these things the same way. And because we have a very systematic way of treating them, essentially all treatment should be the same. Dr. Kack also does older children and adult functional fremuloplasties. And then I manage all of that stuff, including the orthodontics. So that's kind of the thing, is like we look for, and the same thing with our staff. We find what people want to do and they like doing and they're good at doing, and we give them an opportunity to be in that space. And that's for other dentists, like in the future, if you don't want to do orthodontics and you want to learn how to treat infants because you're a pediatric dentist and it's a real big focus of yours, then like you can do that too. So it doesn't have to be all or nothing. It can be what serves you as a provider and what serves your families best.
Liz, one thing I remember so like clearly that you had said once to me that has like resonated and I thought was awesome was like, I remember you saying like, I really still love doing dentistry. Like I love dentistry. And I thought like, you're like, I can love both. Like I love that I'm a dentist and I love that I get to do this. And I feel like some providers or people that I feel like, they feel like it's like one or the other, or like they can't choose. And I'm like, and I think Meggie, what you just said before, like, this is dentistry. This is the age of dentistry. But I think a lot of us, and I'm just curious what what your thoughts are. So many people feel like this is, this redheaded stepchild. I don't know. It's like this doing something so different. And I just like, what do you say to that? What do you like this hearing?
Our mentor, Jeff Rouse, his tagline is just do dentistry, because at the end of the day, like that's what we're trained to do. I had a patient say to me yesterday regarding her child. She said, well, it's not really, because she was kind of like trying to protect herself and not focusing on the aesthetics. She goes, I don't care that much about the aesthetics. And she goes, I care more about the function. I said, well, a functional smile is an aesthetic smile. If we have the function down, if we have the structure right, the foundation first, we're going to have excellent restorative results. And the results are fun to get because they're more predictable, they're longer lasting. You can do a lot more additive techniques to things. Dentistry just becomes a lot more fun when you're looking at the whole picture. Would you agree, Meg?
Oh, 100%. Like doing a case where we address the foundation or we address the bony housing and put it where it's supposed to be because it grew deficiently because the function was off. Getting that fixed and having patients have a better quality of life is so rewarding. And then getting to do the restorative work if it's necessary because of years of attrition or erosion or failed dentistry is so fun because you get to get them back to idealized function and they just look fantastic. And we know that the dentistry is going to be more predictable because we got the risk out of the way, and it's such a peanut butter and jelly situation. All
And
it
jelly, by the way, is my favorite treat.
To the point we're trying to help people feel better. And if you're in your hygiene chair and you notice that Bob has huge tori and a tongue tie and his teeth are worn flat, you don't necessarily need to try to talk him into myofunctional therapy. You can, but you can also just say, hey, Bob, I'm a little worried about your health. Have you had a sleep test before? And when Bob comes back in 6 months and he's had a sleep test and he feels fantastic because he's on a CPAP, you have the happiest patient in the whole world. Like, we don't have to discredit some of the tools that are available to us from other medical providers.
I've had patients.
Not everybody wants to have everything done that we could be proposing for them. We can try to meet people where they're at to just help with symptom resolve.
But there's also, oh, sorry,
I was
Meg,
just
you
gonna
were
say, I've had
saying?
people say like, "Oh, you're so anti-CPAP." I'm like, I'm absolutely not anti-CPAP. Like, great, fantastic, it's there. Thank goodness, right? Thank goodness we live in a time when there are band-aid solutions, and where the medical model has failed patients is that is the only treatment modality that is offered, and it
Yeah.
doesn't get to the root cause. And so,
I'm anti-CPAP on a 20-year-old when we could do something else.
and even a
Yeah.
CPAP as a stepping stone to feeling better along the way.
Something else. One of the things I talk, I think I've been pretty open and vulnerable about is like my mental health. And people are always like, oh, I'm so curious. How would that have anything to do with dentistry? And I'm like, well, first of all, like I'm in, the reason I'm in the space I'm in is because I spent so much time in the dentist as a child because of things I was struggling with. But I'll never forget when I was like 18 years old and this dentist who he looked at me and he goes, you're grinding your teeth so much. You're going to have nothing left by the time you're 40. And I remember looking at him at the time and it felt so personal because I didn't know how to stop it. Like I was struggling on such an internal level. Yes, maybe environmental and other things, but my airway issues were absolutely a massive part of that and definitely adding gasoline to all of these other aspects that were going on in my life. And he didn't lead. He's like, wow, you could get a mouth guard. And at that time, I didn't have a lot of money. It was like, $200 felt like $5,000. And it was so, I want to say it was so dismissive and passive. Stop grinding, get an appliance, don't get an appliance, like not much to it. And I think back that like our goal is like so that people don't just get things like that anymore. Like there's something more to it because a little bit of understanding that maybe that my grinding was a sign of something else going on that wasn't all in my head and all these other things. And the fact that I wasn't sleeping and struggling, or the fact that they had put me on so much Adderall because they said of all my ADD issues. And that was only supporting my clench. Now I'm clenching and grinding even more, and then and then drinking a glass of wine at night to go to sleep. Like, and then you wonder by the time you're 35, why you're like a complete disaster. I got depression after a kid and don't know if you're coming or going. And I knew I was wearing that in my mouth. And I just curious how you guys look at that with a little bit of the behavioral side for children, mental health for adults. And I think you both have a personal, I'd love to hear both your takes on that.
First of all, I'm so sorry that you experienced that and the amount of suffering that you went through because it's suffering. And I think that because it's so common, we have absolutely diminished the impact it has on our mental health, right? To be blamed for something that you're unaware of doing or have no control over is traumatic. And the other piece of it with the breathing component is we know how we feel when we don't sleep well. And if you don't breathe well, you cannot sleep well. Even if you think you're sleeping well, you're not sleeping well if you can't breathe well. And so over years and decades, and being in a sympathetic or fight or flight state for that long, you are going to be anxious. You are going to have a predisposition to depression. You're going to feel shitty. And I think that it's so easy to jump past that. But when people are at that lowest point, when you don't know if you're coming and going, that is the time when the treatment is almost inaccessible. Like you don't have any more wits about you to do one more thing. You're just trying to survive. And so if you can meet the patient where they are and meet them with compassion and say, hey, I'm worried about you. I don't think your health is great. And they can try a CPAP, or they can try nasal dilators, or they can try myofunctional therapy, which is non-invasive. All of these things can tip the needle in a way that can get them to a place emotionally and health-wise where they might have access to doing something more invasive or more helpful or more foundational.
Yeah, and I think, I mean, to your point about moms, like so many of the patients that we end up treating are parents of children that we've treated,
Mhm.
because we're always going to put our kids first, whether we know we're doing it or not. Like we'll put ourselves aside because they're most important, but like we're important too. And so often people are sitting in our consult rooms and they kind of look at each other and they go, that's you symptom wise. That's you symptom wise. And they'll kind of collectively understand that one or both parent could have an airway issue. And it's really cool to see that light bulb goes off, because it almost gives them permission to ask about themselves, especially in females when I bring up like jaw joint health, clicking and popping isn't normal, stuff like that. It almost gives a person who is only offered a night guard an opportunity to look for something more than just that blaming band-aid, right?
Mhm.
So that's where I say, when you're ready and when you're through this, come back and we can talk about it. Like it doesn't have to be confrontational. It can be very inviting and it can be a very safe place. I mean, I have adults that suck their thumbs that have not admitted that to a single person, because they finally feel like there can be a resolution to why they're doing it. Like it's always just about blaming, blaming,
Well,
blaming instead of looking for the strategy.
I think there are so many more. Well, I say, like, you show me a kid that went undiagnosed with myofunctional disorders, I'll just show you an adult that has some new version of it that they're just masking, or they're, compensating, and they're clenching and squeezing and trying to do it, and they're, doing different things to try to maneuver through it or whatever. And then you look at these parents, and I, myself is like, then you end up having a child that has these behavior, sleep disorder, sensory issues, or whatever. And then you have a parent that also probably had these things. They don't know how to do it. It creates a lot of stress on these families. And I always feel like sometimes when parents go into offices, and we don't all have an untethered in our backyard, right? We don't. And we do have to get on planes, we have to travel. And I talk very openly about why I lived down in Louisiana, why, God or the universe brought me down here. And it was, when I come to realize this, it was humbling for me to be reminded again that I was pretty spoiled in New York and in New Jersey and in Las Vegas, like in these really big cities, that you could hop in the car in 2 hours, be somewhere, or you had like different mind where, a lot of this country is made up of these smaller areas and these networks and these communities. And the interesting thing that I learned here was there's a little uniqueness in Louisiana that, most doctors that live here all went to LSU, right? They went to LSU undergrad, they went to LSU dental. They have a dental school, they have a medical school. And that college is not just a college, it's a religion, like it's a culture, right? Like, and you walk around and it's like, these dentists, to change the way they do things, the way they were taught. I mean, it's sacrilegious, I feel like. And I even had friends at like Florida, like, all these different areas. And I thought that was it's such an interesting place to see how healthcare is about this trust and this ability to educate. And there's still a lot of resistance. People say you're crazy, you're talking nonsense. And I I just love to get your take of, how do you handle those conversations?
I guess I just don't know why and this is what I tell families. I say, can't we all just get along?
I know, I wish.
Can't we all just recognize that there are multiple parts of the body, but they happen to be connected? And I mean, I kind of giggle, and because at that point, like, we really are trying to empathize with these families. And it's easy to do because we see it all the time and we've both been through it. But it's easy to just look at them and say, like you did, Megs, I'm so sorry that was your experience. It shouldn't have to be this way. And like, I'm open to having constructive conversations with other providers, and we have a lot of those. And there's one I remember where a sleep doctor called and started just yelling into the phone. And by the end of a 30-minute conversation, he goes, we should get lunch sometime and I'd like to send patients to you. And I was like, well, cool. That sounds great. Like everybody in medicine is trained that we're the best and we're all we need. And we compartmentalize ourselves and we know everything. And nobody wants to admit that they missed something. And that's what I think a lot of this is about. Nobody wants to admit that we missed something.
Well,
So I posted about a patient that I saw. They're 18 months old, they're G-tube fed and have been since they were in the NICU. Sure, they were born early. Sure, they needed it to start, but could they have improved upon function in the last 18 months? They've been through many providers, OT, SLP, aerodigestive, feeding, GI. They just got tongue tied to the tip, like tip to ridge, cannot move this sucker at all. And the feeding therapist at the very beginning said, you know what? A tongue tie is there, but we don't want them to learn a new anatomy. So don't touch it. And the mom kind of laughed and she goes, isn't this the wrong anatomy? But nobody's ever been able to help her to this point, a year and a half in. And now this kid needs tubes, needs to be sedated, probably needs the adenoids out. And sure, maybe there would have been feeding stuff before or along with it, but would it have been this significant that the child's never been able to take a bottle or eat solids? I don't think it would have. But nobody wants to get along, communicate, and collaborate. And that's kind of what we're here to do. Like, we take a ton of pictures. And I think that's the most impactful thing we can do is continue to document what we do, how we co-manage and diagnose, and what improvements we're seeing or not. Because that's where clarity and honesty kind of comes into the medical records. I have so many parents that are like, yeah, they had a clip at birth. And I look and I'm like, I don't really know what was done. Did they take any pictures? And they go, no, why would they do that? I'm like, because how else are you documenting this? Like in dentistry, we have x-rays, we have intraoral photographs. We're held to such a different standard than so many other facets of medicine. I just don't really get it.
so along the lines of like unlearning what we learn as gospel when we are in grad school is that in very few healthcare niches is there not progress, right? There's constantly evolution of research, and maybe it's slow, maybe it's fast, maybe it's focused on one piece of puzzle, but like it progresses. And for some reason, when it comes to airway or tongue ties or something in this realm, there are people that are just digging in and like afraid to admit that we were wrong or that we didn't know enough. And I don't understand that. And kind of like how Liz said it, like, can't we all get along? Understanding and giving each other the benefit of the doubt. Like, we're not trying to create problems. I mean, the only reason we're doing this is because it's personal. And once something's personal, we're passionate about it. So that's one of the ways. I mean, I started a bit more combative with a chip on my shoulder and going after colleagues and trying to like convince
You and me both.
right? But that doesn't work. It just doesn't work. And
I'm too passive aggressive. I'm too much of a people pleaser.
but now
So-
when you start to connect and you learn how to communicate in a way that's less aggressive and less abrasive, you have the opportunity to make more progress. Speaking of Louisiana, we have a mutual friend, Liz and I do, that lives in Louisiana. And she reached out to me knowing that what we do and said, hey, I'm really struggling with my son. He is having a hard time eating. He doesn't sleep well. He's really fatigued. It's creating a lot of behavioral issues. You know, now that I'm watching your content and I'm following along with your story, like I can't help but wonder, is this his story? And so we chatted on the phone. We looked at photos together. I didn't do a full exam, but I was able to help quarterback the case for her. And she had access to an orthodontist who kind man. He hopped on the phone with me, which is unlike some of them. And he just said to me, you know, if this is so true, why aren't we taught this? You know, and I said, I don't know. I don't know why it's so behind. I don't know why the academic level is not catching up with evidence-based research that is on our website. And because of this family's connection to him and because of this mom's power advocacy for her child, he's like, fine, you know what? Do it. So I helped design a laser sintered expander for a 4-year-old on deciduous molars, which is absolute nonsense in the orthodontic world. And this child flourished. You know, he enjoys sports. He's sleeping well. He's not having behavioral outbursts. He's trying new foods. He can breathe. He's not being as productive of his airway. And so those kinds of stories coming from the family, more than me trying to convince his orthodontist that my way is the right way, that story and his exposure to that kid's success is, I think, what's going to have a better chance of influencing a change in how we practice way more than trying to get to the academic level. It's going to be coming from personal stories.
Yeah, it's the families, they're an army, and that's where the power of social media, the power of reviews. Of course, we can't believe everything. That's one reason I think we've focused so much on expanding upon our social media presence is because there's a lot of confusion out there. And if we can bring clarity to one person, we can change one life. And like, it's really cool to read the reviews. It's really cool to read the comments. Even if we weren't personally part of a story, when a mom comments like, my child had this done and it changed their life, other parents then read that and they're more accepting of what we're trying to put out there because we're the bad guys, right? Like the doctors, we're the people that nobody really wants to see if they can avoid it. But when
Yeah.
they think that there's hope or a light at the end of the tunnel for something they've been fighting a battle for their kids, they'll do it.
Well, I think you both are bringing up like a really, very important fact. And I think that's one thing that I've always been really passionate about is that you just got to show it. You got to do it. You can't convince somebody else to do it. You got to show, you got to make them feel it, see it, experience it. And I want to say, and I want to, just to be clear, there's some of the kindest people I've ever met in this state and in this area. And they come out of, and when I say that religion is like, they tried and true. They don't believe, and I don't think they think they're being taught something that's not right. And, if I hear one more time, it's like, well, show me a study that proves what you're doing. I'm like, show me a study that you're doing what is right. Like,
Yeah, there's some stat that it takes 17 years for evidence to come out and be validated. And if we're 17 years behind on just any facet of medicine,
yeah,
like there'd be a whole lot more sick people. Like we're lucky that we live in an age where people are thinking more progressively than the
absolutely.
literature can
Yeah.
keep up. But it's
But
hard. It is hard to fight that battle.
But that actually goes to the fact that there is a lot of discussion and in our industry, social media is huge. You see a lot of presence. You have a lot of people have opinions, good ones, bad ones, whatever. And you see a lot of companies coming out with a lot of different tools and a lot of different things. So, I'm an equal opportunity player. I'm always like, I'm all down, whatever is going to help people. But I also know that there needs to be education on how far things can go and, resources of time and money matter to families. We all know that, right? It doesn't always have to be financial. It can just be their time and also that golden sunlight of a child's growth time. So,
Well,
when you get,
with
yeah,
along the
Meg,
lines of financial, it's one of those things that like I don't want to put my child through it or it's so expensive. It doesn't get less expensive. It doesn't get less
I know.
invasive. It doesn't get easier. It's different and truly
Mhm.
more expensive and more invasive and more traumatic. So as much as I understand that as a mom, like I never want to put my kid through something like I don't want to. And I have a different viewpoint because we get to see what happens over decades of suffering like you went through and I went through and Liz went through. And all of a sudden that intervention, that investment seems way less scary. It seems much more valuable because you're preventing so many other things.
So, after kind of getting rid of it, so your guys' mission is it really kind of in a sense to bring like access to care, like to really try to cultivate and create easier streamlines and to be able to teach these dentists or a better way of doing it and kind of giving them a playbook? Would that be a fair way to kind of look at what you got, what untethered? So we have the educational arm, obviously the practices, but we have the educational arm. So let's dive into a little bit of that. I saw a lot of social media. You guys went on some cool retreats. You did some big things, and then it came out that you guys were launching a course. So, what can be expected? This course is meant for doctors or for parents, just to
The course is for doctors. I mean, our primary participant that we were envisioning was dentists, right? We are dentists. And unlike some of the courses that are out there, we're not only doing frenectomies, we're not only doing ortho. We are, like Liz says, from womb to tomb, general dentists that see the restorative sequelae of airway suffering. So we really wanted to speak to dentists. We also think that it would be beneficial to a myofunctional therapist or a speech pathologist or a body worker to take it because it gives insight into a branch or a philosophy or a treatment modality it's overlapping with, but is not the same as what you're doing. What would you say,
wow.
Liz?
Okay.
Yeah. And I mean, I think along those lines, by empowering families to ask better questions and bringing awareness to airway health, we're also asking those families to ask their provider to do them a favor and render some treatment that they may not know what to do. And so that's where other families can then refer their dentists, take our course, learn these techniques, learn the thought process so that you can better help our community. So, yeah, our goal is to help expand access to care, not just by making dentists learn it, but by asking families to ask for care
Yeah.
because they're not going to do it if they don't know they need it.
That's I mean, it's true. I mean, we have to fill our parents' toolboxes to ask better questions and not just accept. I always say, don't just let the doctor tell you what they ask why. Why did we do tubes twice and they still don't work? Yeah. Yeah. Why? Just give me a little bit more behind that. And I think that's a big place for them to start. So in the course, is that something that they can learn a lot from? Like, what will be some of the key takeaways?
So the therapist, yeah. So there's going to be parts of it that we talk about that are helpful for the general dentist to implement into their practice that are obviously irrelevant to a myofunctional therapist. However, it gives them the insight into what is possible in a dental office. And it does give verbiage. When I have a patient that comes to our office through a myofunctional therapist, I'm going to use this as an example. They are so well educated and they're so ready to undergo a season of treatment to get to a more stable foundation, right? To be healthier. So if the therapist or the auxiliary body workers or any other care team member understands the possibilities that we can do, it helps establish better referral back and forth, right? It helps that collaboration and communication in a way that is invaluable because the patient then has access to something that wasn't there before. So it's a really long way of saying I think that there's a lot for the therapists and the other providers to learn knowing what we can do. And it's also just full of one-liners and talking points and verbiage around explaining the detrimental effects of having compromised airway, compromised sleep, or having a foundation that's dysfunctional.
That's
And
great. Just giving people more tools to be able to communicate and help people. And well, I mean, that's another thing. We do really believe that like myofunctional therapists and auxiliary workers are truly the bridge for you guys,
Totally.
right? We can really airway traffic control over to the right people, make sure they get to where they need to be. And I think giving them more confirmation and tools to be able to do that is a win-win for everything. Because even dentists that might not, that are not against it or for it, if you send a patient that's like locked and loaded, that is like, hey, doc, I want to do this. I know it's not about the teeth, it's about the airway. You're way more likely to make a doctor more comfortable to do a treatment plan when they have a patient that they don't have to convince on the treatment, right? Like they don't have to like pull them because then that opens up liability and concerns there. And I think that really just compounds and really is really a true testament that it is all about educating people, right? So the key is that through education, it sounds like.
Well,
That's
I
where
think
you
it's an
guys
easier entry
are like,
point too, right? So like if let's say you're a new dentist, you're not a new dentist, you're a dentist newly exposed to airway and the concept of wow, breathing is impacted by how the mouth is set up and how the muscles function and vice versa. And you're like, okay, I don't know where to start. You take our course, you start to go down this rabbit hole, and you start to notice things. You don't have the wherewithal or the confidence yet to do anything with it. One of the easiest entry points is, hey, I noticed that you're using your facial muscles differently or you grew differently. I'm going to make a referral to a myofunctional therapist. Easy, easy, easy access for the patient, either locally or virtually. It is non-invasive. Starting with a comprehensive evaluation with a myofunctional therapist is then going to open up their eyes to something that the dentist may not have been ready to see or say, right? And that patient now has much more likelihood of now going down a path that's going to get them to treatment than if the dentist doesn't quite know what to do with that information. The myofunctional therapy inlet, I think, is a really easy access for the provider, but also for the patient. And everyone
absolutely.
needs it. We're also dysfunctional.
One area I kind of want to roundabout and kind of bring us full circle. Liz, I saw you make a post that I thought was so powerful. I loved it. I know I shared it to a bunch of people. And it was you in a store doing a little scan of all the back to school snacks.
oh my gosh, yeah.
And I was like, oh my gosh, that is so like, it was so perfect and so raw and so true. And I thought that's like a really great place to kind of bring this is like, that's a big issue we're fighting is the food quality, right? Like, and the parents and even adult, like that's an uphill battle. So I just love your take on that. And I'd love you to kind of just push in a little bit more there and talk about it.
Yeah, I mean, I think one of the hard parts about us as a society is we are going backwards when it comes to food and nutrition. And it's not everybody's fault. It's what's marketed at us and thrown at us and affordable. And the post you're referring to, I was at the store and it was like early August where we go back to school. And all that's there is high fructose corn syrup, food dyes, stuff that's melty and squishy, like nothing that's nutritional value or value for growth and development of our brain or our body. But it's cheap, it's right in the front of the store, and it's on the end cap. Like you think it's supposed to be good. And if you're a parent who has never really valued or known much about health, you're not going to know much different for your kids. So I think the food industry, the medical model, it'll be a really interesting conversation over the next few years as we start to dive into some of the things that are not acceptable in other countries but are acceptable here. I mean, there's so many layers to that industry, but it is impacting the way we grow. If you go to Target in the baby aisle, I mean, I have favorites for products, and not one of my favorites is sold there because they're
Wow.
not easy to market. Orthodontic pacifiers, for example, like that's a big name company, but they're horrible for development. Same thing with bottles. It's marketed as like it's shaped like a breast, so it's better. They just lead to more dysfunction of the oral muscles at the most important age. So we're really victims to marketing across the board when it comes to products and influence. And so it's hard because we're fighting.
Accessibility,
Yeah.
right? Accessibility, and we live in a world where, that's a big part of it. I mean, it's a large hill to climb, but I think just doing what we're doing right now is just talking about it. I couldn't not comment on it because I was like, that's such a great post. It's true. Like everybody was walking in that same store, seeing the same things and not even thinking like, gosh, that was all that was being, that's
Yeah.
all that is out there.
But
And
to your point, this is an access problem. And like what we're talking about is it's really unfortunate that there's not more access and education. And a dear friend of mine, my functional therapist, posted something the other day about if we're doing vision screenings and dental screenings in every school, especially those that are in underserved communities, why aren't we screening for airway health? Why aren't we checking to see if these
Or
kids
from the
can-
perspective of like, there's speech pathology in schools. What if they had, and I know it's tricky, they can't do anything healthcare related, but like, what if they had a better understanding of function? And if they're helping articulation, they're also at least helping some of the functional issues at like a mass, right? Like at the base level.
well,
screaming for
screening
like,
is our
can't even breathe. Like, can we get them somewhere else? Maybe
health.
it's not us, maybe it's the ENT because the tonsils are touching, but nobody's even looking.
Well, screening it to me is one of our biggest issues. And I just feel like nowadays, like, so that's been actually one mission that I've been working on a lot is like just coming up with a very bare bone basic screening thing for every dentist, like so cost effective, like some CEs, it's no big deal. Like let your entire team watch, just get everybody screening. I don't think you need to be somebody who does any of it, but I just need you to know to educate, talk about it, and send it somewhere else. And I realized that one of the things we were doing in the airway community was we were outpricing our courses into a place that someone who just like wanted to dabble a little bit and see it was struggling. Like I said to somebody, I was like, well, do you know what the fairest sinks is? It's free. And they were like, they looked at it, they're like, I don't even like they needed more behind it than just seeing it and they didn't want to read it. So I think there is obviously always opportunity for us to grow in screening and things in those. And so it sounds like that is exactly what you guys are doing and definitely with the content.
Well, even
So
like,
great.
even if you're not going to treat, or you don't want to treat, or you don't know how to treat, screening is one thing, but also like there is so much benefit in just saying that I don't know, right? Because there are a lot of providers like, oh, that's not a thing, that's a fad, that's a whatever, and that I think does a lot of harm as opposed to being like, I'm not aware, I don't know. It's okay to say you don't know because you're not shutting somebody down, you're not closing that door, and you're not creating or adding to this like mess of confusion that families are living in.
Yeah, you actually sound like less of an idiot than you will 2 years later when the parents realize you didn't know. Like that's what we hear all the time. It's like, I don't know why they just didn't say they didn't know. Like why
I
they
don't know. I'm not from, I mean, I've heard about that. I just don't know enough about it yet. I think that's really interesting. Let me know
Well,
what you learn on your journey.
Well, I was just gonna say, I actually that's a perfect way to go into like a little bit of a personal segue. Not a lot of doctors, their egos will allow them to say that. And I say that with really kindness. Like that is not coming from a place of judgment. Like I don't know what it's like what you guys had to do to earn those credentials. And I honor all of that. And I think there's a part of you that you have to have that strong ego to get through it. But it is hard sometimes on the other side to soften.
I think we're all cut. I mean, we're all cut from a similar cloth, right? Like those people that are driven to get those credentials usually have an ego, right? Like that's part of why
You
they
kind of
went
want
on
that. Like you want your provider to be confident in what they're
Yes.
doing. Like if somebody's going to move your facial bones around, you want them to have a certain level of confidence.
Exactly. Yeah. Or I should say that ego, we all have egos and egos are great, but there's also a side of just humility and being able to kind of say, hey, you know what? I just don't know that. That's just not my area of expertise. I haven't spent a lot of time really training that, but I know a bunch of people that this is their wheelhouse. This is what they eat, live, pray. Let me get you over to them. I think there's something so vulnerable and so honest about that. I know as a patient, that's all I want to hear is somebody to say to me, I
Well,
don't know what I don't
and
know.
that's part of what we created with our website too. Like obviously it's self-serving, it's directing people to our practices, right? It's how people find our practice, but we also really tried hard to make it a public resource where you can go to get information. So even if you aren't going to treat and you just want to send patients there as like, hey, go look into what they're teaching because they can at least help you.
Which
And I
is
also, one reason I was really adamant about making that part of the page is kind of got tired of feeling like people wanted me to prove myself to them. Like we'd have families come in, a mom and a dad with a baby, and mom would be like, I'm here. I've been to all these appointments. I feel so supported. And you've been recommended by 3 different people, and we finally made it. And the dad hasn't been to any appointments. He has no idea what's really going on. And all he wants me to do is encyclopedia literature at him. And like there's this huge level of animosity between the 2 parents. And also, I don't need to prove that I'm smart to you. I don't care that much. And ultimately, I don't care what you do. I want you to do what's right for your family. And until you go home and do some of your own research and help yourself understand what we're trying to accomplish for you, it's hard to like try to prove that what I'm doing is right. So yeah, it's difficult as a parent to navigate this stuff. It's difficult as a provider to navigate this stuff. It's hard across the board, but that's why I'm so glad you made this podcast. And we made ours too. I keep
I
forgetting.
know. I was just going to say, so ideally, anyone who's listening, where do you want them to head to? Do you want to head them to the website? Do you want them to start following you? Should they take a course? Where should they go?
All of the above.
All
Yay.
the above?
Yeah, I mean, because of where you are on your journey, what you're looking for. If you're a dentist and you're interested in understanding more and maybe being an airway quarterback or maybe implementing some of this stuff into your practice, take our course. We think it's great. It's a culmination of all of our education combined. If you're a parent or a patient and you're interested, go to our website or follow us on social media.
If you want to dive a little deeper, if you're a parent and you're looking for a consult or a conversation, come to our website, do some more research on our social media. Like we put out a ton of stuff across the board of all ages. And on our podcast, I'm really excited. We have a number of guests that have already been on it, from neurofeedback to pediatric PT, chiropractic, and then a ton of our own kind of ramblings and musings. So I even have an episode on circumcision, which I'm really excited about because I don't know if you guys
Oh,
know it,
it's so
but
good.
the AAP doesn't support circumcision the
I
same way we
know.
don't support tongue tie releases yet. How
And
many
let
of
me tell you
you
something.
had informed consent when the circumcision was done? Like I
Well,
know
they
I
did a
did,
circumcision on Jackson, and then I ended up having to go to the urologist, and he needed a surgery afterwards,
right?
right? I
Yeah.
mean, so
Like we don't look at everything same the way we should. So
and I didn't
that's kind
ask.
of the
I
cool thing
didn't
about the
say,
podcast.
I should have asked, where's the research on this?
I
Go
didn't
to my
know.
website.
The guy was like, "Hey, come on, it's time." Like he woke me up and I went and watched and I was like, "Ooh, that was a little more than I thought that was going to be." Plus, I don't even know what we're doing. Like I'm not really sure about penile anatomy.
I know
So,
there's so much to it. Well, ladies, I could talk to you guys, both of you, all day. I cannot thank you enough for coming on, and I sure hope that I can have you guys back on.
Anytime.
Um,
So fun.
I absolutely love it, and we are so excited to see everything that you are doing together. Truly an absolute pleasure to watch what you're doing. And it's so much fun. And it's so great to see the two of
Ditto.
you together.
Right back at you. Right back at you. And we'll see you on our podcast soon.
Yeah. And thanks for all you're doing in building awareness and all you're doing with really just supporting people getting through. Like, you've been doing this a long time, and I don't think you give yourself enough credit, but it is pulling personal journeys into professional. It's hard, but I think that's one thing all three of us are trying to do as much as we
actually, I was going to say, we try sometimes to ask, but like, for me, like, what does mind your mouth mean to you? And for me, it was like, I realized that the power of supporting people was through storytelling, because you need to make people feel something. And I think what the two of you are doing is exactly that. And I really do. I think together you guys are a force to be reckoned with, and really excited
Peanut
to see
butter
what you
and
guys.
jelly.
Absolutely, you are. And it is my favorite treat.
What are you, Liz? Are you the peanut butter or the jelly?
Considering that's like my primary food source, is peanut butter. You can have the jelly.
All right, got it. I'll be jelly.
Okay.
You'll be jelly.
We can
Sweet,
trade. It's fine.
color, because you can have so many colors of jelly, right?
So
we can
many
have
textures and colors.
Yeah, you should try to design an office with Meggie Graham.
Absolutely. Oh my
God,
God.
how that goes.
Let me try.
All right, ladies. Well, thank you so much. We will see you soon. Thank you for joining us on another episode of Mind Your Mouth. Until next time, have a wonderful day, and we will see you again soon.